It's my great pleasure to introduce our keynote speaker today, Professor Harvey Rubin. Dr. Rubin is a professor of medicine at the University of Pennsylvania and also a professor in the Department of Microbiology, Department of Biochemistry and Biophysics, as well as Department of Computer and Information Sciences in the School of Engineering and Applied Sciences. Dr. Rubin received his PhD from University of Pennsylvania in 1974, before most of us were born, and his MD. Well, it's humbling to be here.
Thank you so much for that.
And he received his MD from University of Columbia in 1976. He joined UPenn in 1983 and became a full professor in 1998. Dr. Rubin is a world-renowned researcher in tuberculosis. His research has been funded by NIH, NSF, DARPA, as well as Global Alliance for TB Drug Discovery. In addition, his work in basic biology and diseases has extended the investigation to mathematical modeling of complex biological systems. Dr. Rubin is the director and co-founder of ISTAR, the Institute for Strategic Threat Analysis and Response, as well as a new center, Energize the Chain. Energize the Chain is actually a pretty exciting organization. Their mission is to leverage pervasiveness of cell towers throughout the world to provide power source for vaccine refrigerators in remote areas in underdeveloped countries. ETC has launched programs in Zimbabwe and Ghana and is now expanding in other countries. Energize the Chain was founded to solve the missing link in the delivery of vaccines to the world's poorest and to eradicate vaccine-preventable deaths worldwide by making effective vaccines as accessible as global cell phone coverage. And if you use a cell phone anywhere in the world, you should be able to access vaccines. And I think that's the most noble way of using that power source. And so without further ado, thank you for coming here today, and it's an honor to have you.
Thank you.
Keynote speaker.
Thank you so much, and I'll speak quickly in case I expire before you. So I want to thank you all for coming, and I certainly want to thank the organizers. That's our beautiful building here, Penn Engineering, the entire REACT team, the American partners, as well as the French partners. And I want to thank Solvay for sponsoring this kickoff symposium. I hope it's as successful as the 5th Solvay conference in 1927, 89 years ago. 17 of these guys went on to win the Nobel Prize, same group. So I don't know if we'll be as impactful as Vijay said, but perhaps we'll look back in 89 years and we'll have that. We got to get a conference picture, right? We want. So with that. So the question then is, the thing is, can we improve the human habitat with global engineering? And everything you heard this morning really is, in my way of thinking about it, global engineering. So first of all, what is the human habitat? Secondly, what is global engineering? And thirdly, why care about any of this stuff after all? So, the human habitat is a lot of different things. This actually was my grandparents' habitat. So I want to thank the French. My grandpapa and grandmama came from Alsace. And so that habitat is probably no longer the way it was when they were there. But that was my ancestral habitat. This is a habitat that we hopefully will never have to see again. This is what happened in Paris after the terrible terrorist attacks. But you see, everybody is crowded together. We heard about water. We heard about the infectious disease. We heard about electricity. This is a cook stove in Africa. A cook stove in Africa, mostly this is disproportionate. It affects women. Women who hover over cook stoves because there's no sustainable electricity that you heard about have the equivalent of smoking 3 packs of cigarettes a day. It is really a remarkable problem in the developing world. And I will tell you about this part of it. This is the human habitat. What is the human habitat? That's everything that goes on not only in these crowded areas or the global situation or water, but it's what's on you and what's in you is now a new way of thinking about the human habitat. And here is the cover story from The Economist, Microbes Make the Man. And these are a few recent papers, and I know we have people from J&J here, Solvay, the infectious disease group, so I actually see patients with infectious diseases. But you know what? We're all colonized with all sorts of, there's a veritable zoo living on us and in us. And so, you know, this is humans differ in their personal microbial cloud. And I always think of peanuts, you know. Fecal sampling might identify patterns of gut microbes that contribute to obesity. And in this particular paper, our results confirm that an occupied space, that is, if you sit in a room that's microbially distinct from an unoccupied one, and demonstrate for the first time that individuals release their own personalized microbial cloud, their own habitat. So habitats are everything. And so how we think about that, how we protect ourselves, how we interact with people is all part of the human habitat. And so the grand challenge then is, can global engineering contribute in some way to controlling that habitat, making it more habitable, and making it just a better place to live? And so I'm going to show you one example. The human health. Who wrote this? Must have been some old guy. But here are the others, and here's the grand challenge. And you'll see, you know, you could read these slides over and over again, and it just doesn't matter. So these are the Sustainable Development Goals. These were the original Millennium Development Goals from the United Nations. Last September, the UN voted on a whole new set of development goals, now called the Sustainable Development Goals. And if you look about that, these are grand engineering challenges, right? They're grand societal challenges, as Vijay said this morning, but they're also, in my mind, and I think in this room we share that concept, these are really, many of them, grand engineering challenges. And so, you know, zero hunger, education, gender equality. Again, a woman who sits over a cook stove is really it's a gender problem. Women who have to schlep their kids to a vaccine center, it's a gender problem. Clean water, we heard a lot about that. Affordable and clean energy. So a lot of these UN Sustainable Development Goals are really engineering grand challenges. And I challenge all of us here to think about global engineering to solve many of the problems that we see here that have now been sort of validated and verified by the United Nations. Climate action, life below the water. We heard about life above the water. This is actually life below the water. So there are a lot of things that we could do as an engineering community that will really impact these Sustainable Development Goals. And my other, this iStar that we run actually has consultative status at the United Nations. So if there are, we put on a big meeting in ECOSOC at the UN last year on infectious disease. So if there are technology issues that you want to bring to the attention of the UN, we have ground passes to the UN, and we could put on meetings at the United Nations. And I think that's something we should explore because it's a great venue. If you look at the World Economic Forum just this year, 2015, top 10 global risks in terms of impact: water crises, spread of infectious diseases, weapons of mass destruction, and interstate conflict. Everything we heard about this morning impacts those top 5 impact risks that are identified by the World Economic Forum. You know, again, for what you heard from your dean, the work that you guys are doing here really does have an enormous global impact. I mean, you know, you knew that when you started the program, the REACT program, but it's certainly validated by groups such as the World Economic Forum. So imagine living in a habitat where people develop horrendous pneumonias. This is an X-ray of somebody who has a terrible left lower lobe pneumonia. Imagine living in a habitat where kids are dying of dehydration because they have uncontrollable diarrhea. Imagine living in a habitat where tetanus is ubiquitous. This is a poor little kid from tetanus. Imagine living in a habitat where children are dying of measles. Now, you know, this is West Philadelphia. It's Grenoble. I had a wonderful opportunity to give a talk at Joseph Fourier and ran in the Alps. It was just beautiful. But this is where the majority of the people are actually living, where this habitat is not just a theoretical construct. This really happens. And what's remarkable about each one of these diseases is, guess what? They're preventable. They're preventable. So the World Health Organization proposes and gives a number of about anywhere between 2 and 3 million children under the age of 5 who die of vaccine-preventable deaths. Hundreds of thousands of kids, influenza B, whooping cough, measles, tetanus, pneumococcal pneumonia, rotavirus diarrhea. These are hundreds of thousands of kids every year, up to about 2 to 3 million every year. And you can calculate how many that is per minute. It's really quite shocking. So, why is that? It's an engineering problem because you have to keep vaccines cold. Vaccines have to be kept between 2 and 8 degrees. If they freeze and thaw, you guys are all material guys. You freeze a protein, you freeze things and they thaw, they denature. They heat above 8 degrees Celsius, it denatures. The worst thing in the world for a vaccine is for it to freeze and thaw or get above 8 degrees. The vaccine has to be kept cold from the minute it leaves the manufacturer till it gets to the national airport. That's generally pretty okay. It comes in a big refrigerated plane. It goes in a big refrigerated truck. As you go down the so-called cold chain, it degrades. The ability to keep these vaccines within that very narrow temperature range degrades dramatically. And that's why 2 to 3 million kids a year die, because they're getting an inactivated vaccine. Actually, they may not, if the healthcare practitioner was doing the right job, they would record it and throw it away. Many times, they don't want to record it and throw it away for various political and economic reasons. They just give the bad vaccine to the kid. And this is how vaccines are delivered in the developing world, for the most part. On the backs of camels, on the backs of on bicycles. It sits in a storage place like that, which I guarantee you is not between 2 and 8 degrees, until it gets into this poor little kid who's going to get an inactivated vaccine. And so these are actual pictures of how vaccine, I guarantee you that's not between 2 and 8 degrees. I guarantee you that. So, vaccines we think about in terms of actually saving lives, but it really has a much broader impact. And that's why those sustainable development goals really is in effect really what we're doing here at Penn and what you're doing. So there's clearly public health benefits, but it does empower women. I can't tell you how many stories I've heard from my colleagues around the world and the developing world who say, my mom would have to take off from work or go away from the farm or whatever to bring me to the doctor. So sometimes they didn't go to the doctor or they just left their farm. It certainly promotes economic growth, and it increases equity, and the World Health Organization actually thinks that it does promote peace. Failed states really is closely integrated with sick populations. There are some huge societal benefits. Obviously, if the kid stays healthy, the healthcare system doesn't have to spend as much money on taking care of people. Prevents development of antibiotic resistance, certainly extends life expectancy, and if we're nothing else but selfish, it makes it safer for you and me to travel to the developing world. And so this is not, these aren't my words, this is words from the World Health Organization. So here's a logical proposition. If vaccinating kids is so important for all those reasons, and keeping vaccines at the appropriate temperature is so important, just plug the damn refrigerator into the outlet and get going. And there's the international outlet, and get going. Well, not so fast, right? This is the famous picture from outer space looking at the energy poverty problem. Again, things that you folks are actually working on here and now. And so, 3.5 billion people lack proper access to energy. So there is no outlet to plug the refrigerator into. I mean, this is sub-Saharan Africa. It is dark. In Southeast Asia, it is dark. South America, it is dark. There is no electricity to plug these simple vaccine refrigerators into. So, okay, Rubin, no electricity, no vaccine refrigerators, go home, go back to your lab, work on, enzyme kinetics. Well, engineering, global engineering can have a huge, huge impact. And here's the example. No power? That's just wrong. Do you know there are more cell phones in the world than there are toothbrushes? There are more cell phones in the world than there are toilet bowls. And the industry is, I learned that statistic, by the way. I was sitting in an NSF grant review committee at one of these big grant things, and a guy from Nokia was sitting next to me. This is about 10, 15 years ago. He leaned over and he said, there are more cell phones than there are toilet bowls. I said, that's a number I got to keep in the back of my head, because that's gonna be important somewhere. And so, But the cell phone industry is growing exponentially in the developing world. By 2020, or so, everybody in the world will have a cell phone, and oftentimes two. There are no landlines in the middle of Zimbabwe, trust me. So if there are cell phones, there are cell towers, and cell towers don't work by magic, they work by electrons. And so we just made the simple proposition, co-locate refrigeration systems with cell towers. They're everywhere. They're 2 kilometers and you find a cell tower. It's financially and environmentally sustainable. It's scalable because the industry is going to scale. And we can use the connectivity to monitor and locally manage these refrigeration systems. And so here's actually a picture of a cell tower right next to a clinic in Zimbabwe. Right there. All you need to do is plug that refrigerator into it. And so, why didn't I think of that? So what does an academic do when he or she solves a problem? You write a paper, right? So we wrote this little paper back in 2010, and it came out in the New Scientist. And there's the picture the artist drew, and there's the refrigeration system, and here's somebody plugging it into the tower. And we just said, just use the energy available. It costs about the load on the cell tower is almost zero. Maybe it costs 60 cents in the equivalent of diesel fuel, but it's almost zero load for the cell tower electrons. And guess what? We wrote that article, and literally, no pun intended, it kind of went viral, and I was invited to go all over the world. And I was giving this talk in Mombasa, and an engineer from Econet, which is the largest mobile phone operator in Zimbabwe, came up to me, and he said, we're going to do this. My boss is a fellow named Strive Masiawo. He's a great philanthropist. He's on the board of trustees at the Rockefeller Foundation, and we're going to do this. And before you turn around, they actually did it. So in Zimbabwe, remember that picture that the artist drew? It actually looks a lot like that. This is the vaccine refrigeration system. They were very generous. They put our logo up there, brought to you by Econet, Vaccine Shelter. And this is now we have about 150 sites in Zimbabwe, all over the country. And how we located these sites, I'll tell you about in a minute. What we do is we go in there and we figure out where are we needed. We're not needed in Harare. We're not needed in Nairobi. We're not needed in the major cities for the most part. So we do a site assessment. Where are we most needed? This is a public-private partnership between the Ministries of Health, the cell tower companies, and our nonprofit. We get the cell tower company to build the site, and we set up the equipment. That's usually UNICEF, USAID, Gates, Gavi, whoever's going to buy the equipment. We finish it up. We tack up our little logo here. It's inspected, and then we hand it over to local managers. And the really interesting thing is that every refrigerator we put in place has a data logger, so that we know exactly what the internal temperature of that system is, what the external temperature is, when the door is open or closed. We use the cell tower connectivity to go and say to the local manager, the door is open, go close it. I wish I had that when we were driving to Boston. My wife said, did we leave the refrigerator door? So this has been used maybe in Zimbabwe 15 or 16 times. So the system is very robust. It really does hold its temperature. So we use this remote monitoring system. This is a 1-minute video.
Life was not always like this. We were losing a lot of babies. A simple vaccine was all that was needed to save their young lives. But the vaccines needed to be kept cold, from 2 to 8 degrees Celsius, against our African heat. We had to throw away lots of these, and it was such a challenge. Then Econet, through its Energize the Chain program, installed close proximity refrigerated containers. These simply use the excess power from the wireless base stations. Now, we don't have to worry about that anymore.
By creating innovative solutions, Econet Wireless is promoting community transformation and joins the fight against the top 5 child killer diseases. Econet Wireless, inspired to change your world.
So if somebody's going to ask me at the end of this, why does the private sector get involved? And you'll see the answer here. So that's Zimbabwe. We're up and running about 150 sites or so. Just a month ago, I was in Accra in Ghana, and we're rolling it out now in Upper West, Upper East, and Volta, which is a tremendously difficult environment habitat to work in because many of the villages are along the lake, and we've got to deliver the vaccine via by boats and planes and all kinds of things. This is the Ministry of Health, and this is the habitat that we have to work in. It's not Broad Street. This is a difficult habitat to work in, but it's up and running now with American Tower, which is an American company with a major cell tower company in Ghana. It's actually a path optimization problem. And so this was a GIS mapping in Ghana where we looked at all the health systems, and using GIS data, we mapped a hospital to the cell tower. This is about a half a kilometer away. And how do we know where to place? You could actually see the shadow of the tower there. And so this is the optimal path for vaccine delivery in Upper East. We have mapped every single health center with every single cell tower and have figured out exactly the optimal path. And we're going to have a teleconference tomorrow. This is going to be rolled out literally within the next month, around 35 sites in Upper East, Upper West, and Volta with American Tower and the Ministry of Health. So here we are in 2013, 2014. We've vaccinated about 250,000 kids in Zimbabwe. 14 to 15, we're going to be up to at about 500,000 kids. And 2016, we're going to be in Ghana. We're going to be, my student Alice Conant was a Fulbright Fellow last year in India. We have a place she worked in Karnataka State and realized that that's not so necessary there because the grid is pretty reliable. This is the vaccine shelter, the vaccine system now. And we're going to be in Rajasthan in about 35 to 50 sites, hopefully with American Tower. So we're moving into Rajasthan. We've been invited Nigeria, Kenya, Uganda, and many places in South America. We just, we got to build up the infrastructure to do that. New Scientist wrote that they published our original article. They came back a year or two later and said, does it work? So they sent their own investigative reporter out. He interviewed lots of people in Zimbabwe and actually very kindly wrote this paper in the New Scientist for us, where they concluded, in fact, tower power does save lives. But that was only the beginning. And this is where this relationship that we have with REACT and the School of Engineering is really important. When you start thinking about the problem, there are tons and tons of really interesting research projects that go on. And in fact, we're putting together an NSF grant right now, and I got to pick your brains, Russ, about how to do this, where it's one of those industry innovation grants where there's an academic component and a private sector component, and it's all going to be about optimizing the logistics. And you have to have private sector partners, and we have all of our towers and everything. So we're putting this together. JD is involved in this. VJ is involved in it. So how do you keep track of all these kids we're going to vaccinate? You go to your pediatrician, and she looks up the electronic medical record, blah blah blah, goes to the refrigerator, everything. In the middle of Zimbabwe, in the middle of Ghana, there are no electronic medical records. And in fact, because of the refugee problem, because of moms dying of HIV, who knows who's going to bring the kid in the next time? Could be an uncle, could be an aunt, could be, an aid organization. How do you know that this little Johnny here is the kid who got the vaccines last time? And so fingerprints don't work, by the way, in kids under the age of 5. Neither do iris scans. So we have a little research project with John Boshi in engineering to do infant facial biometrics. And doing facial biometrics in infants is really hard because they don't sit there. If you're 20 degrees off center, even as an adult, it's a tough problem. Imagine a 1-year-old moving all around. So with John Bo and my student Alice, we've got this grant, and we're starting to work on infant biometrics that will go into the cloud. We have the connectivity at the cell tower, and we'll be able to use that kind of connectivity to say, who is this kid? What did they get? What did they get last? How do we keep all that information secure and safe? Well, that's that whole problem of differential privacy. And if you spend any time here at Penn and you go to any Penn seminars, you'll hear George, you'll hear Aaron, lots of people talk about differential privacy. It really works not only in the banking world, but it certainly is an important issue here. How do you do real-time inventory? When we talk to our colleagues at UNICEF, the one thing they're really worried about is the data. How do we know that you're running out of polio vaccine? in the most remote part. The last thing they want to do is have to bring out, 16 vials of polio vaccine, and what they really need is pneumococcal vaccine. Who keeps those records? The records are now pieces of paper. So we really have to figure out how to do real-time inventory and feed that all the way back up the chain to the manufacturers. And then last but not least, and again, this is where the story about energy and batteries and is really very important for us. Can we autonomously actually surveil what's out there, figure out that down there may be Ebola or something like. By the way, if there was an Ebola outbreak again, and I get asked all the time, how are you going to deliver vaccines? And we had a vaccine to the most remote parts of the world. If you had to get to Rajasthan and deliver a polio vaccine, how are you going to do that? It's way the hell, So we would love to have a way to do autonomous surveillance, and that's where a project that we have in our NSF grant is going to be a serious component, and then autonomously deliver vaccines to very remote places. And of course, that's what we do here at Penn. But getting the payload and the energy is really a serious problem. And so, if you can fly for 15 minutes and you can only go 2 kilometers, well, that's one thing. By the way, you could use, in principle, the energy at the cell tower to recharge an autonomous vehicle. Now, that's not something that I've talked to with our cell tower folks, because 60 cents to run a refrigerator is okay. We got to figure out how much it's going to take to recharge an autonomous vehicle. But as we go forward with our private sector partners, I'm sure that there'll be. In fact, we do have a pilot project thinking about up and running in India. So this is what we're calling HITS, High Impact Technology Solutions. And so these are something. I came up with this acronym before I heard about REACT. But your solutions are HITS. They are High Impact Technology Solutions. So we call that Energize the Chain Labs. Maybe we have to think of another name for it. So that was the grand challenge. How do you improve the human habitat with global engineering? And I think, Penn could be the absolute first mover in this world. The medical school where I live, for the most part, everybody, the magic word, the sort of the grail now is global health. Everybody has a global health program. We send kids to Zimbabwe, we send kids to Botswana, we send kids all over the world. Global health has become the hot thing. Global engineering, not yet. But I really believe that with the kind of things we heard about this morning and this afternoon, Penn could be, with all of our partners, so Penn could become the prime mover in global engineering. MIT has a little bit of a program. We're not the only ones. MIT has a bit of a program. Stanford has a bit of a program. But I think we could really become something very exciting. I showed you one example in human health. I spelled it correctly. But the other problems remain, the ones that you're actually working on, which is really very exciting for me. These problems remain. And the actual basic science behind these sustainable development goals, if you dig down one level, you'll find some very, very interesting basic science questions, basic engineering questions. And so I think we just need to sort of, parse this out and see what are we good at? Can we do it? Can we put, in our NSF grant, it's called test bed. So we're lucky we have a test bed in India, test bed in Ghana, test bed in Zimbabwe. We have test beds right now for guys that are going to the developing world. We can collaborate and have real test beds with real faculty. We have a collaboration with the university in Ghana who are going to do some impact assessment with us in terms of Energize the Chain. So how are we going to meet that challenge? REACT is a great start, just an absolutely great start. But we really need, as you said, how do we leverage REACT to do something really huge, really big? And these are some really interesting things. You should get a hold of this book called The Idea Factory of Bell Labs, how Bell Labs was built. Bell Labs was built with no walls. I mean, they had engineers sitting next to chemists, sitting next to biologists. Do you know who was the best, most deepest research in wood preservation? If you buried wood in the ground, it was Bell Labs. Now, why in the world would Bell Labs care about preserving wood in the ground? Because their whole business model depended on keeping telephone poles in the ground without degrading. So Bell Labs was the most advanced work on wood preservation buried in the ground. And so that was the kind of multidisciplinary thinking that went on at Bell Labs. So they had geologists, and they had physicists and mathematicians and Nobel Prize winners sitting in the same building. This fellow, you got to read this book. This is a book called Toledo Park. This fellow is Alfred Loomis. Alfred Loomis was an investment banker, and he got interested in science. He became a philanthropist. He really was the guy that put together the MIT Rad Lab to do radar. In addition, he funded E.O. Lawrence to build the cyclotrons, and you have a nice cyclotron in Grenoble, right? He funded to an enormous extent E.O. Lawrence, and he had, he was the guy that funded Lawrence's brother to do radiation therapy and cancer chemotherapy with isotopes. And so he also thought there's ways to do multidisciplinary work. And of course, Bletchley Park was where you had all sorts of people, chess players, mathematicians, physicists, language experts sitting in one room to really, to solve the Enigma problem. And so what I think we need to solve to meet those challenges, the Sustainable Development Goals, we need public-private NGO partnerships. And that would leverage all of our NSF grants. It would certainly leverage my NIH grants and leverage everything that we do. We have to think big, though. And we call it somebody said, the SING, well, we already had that name in this building, right? High Impact Technology Park or the REACT Park, but that's what we need to do to solve these problems. And what's really exciting is that the people who can do it are actually sitting in this room right now. And so it's just a thrill for me to have a secondary appointment in engineering, because I got to tell you, my medical, and I said this even over in the medical school, my medical colleagues are really innovators and they do great stuff. I have never met a community of people who are more willing to think outside the box than the guys, and it started with Eduardo and Vijay and Russ and every one of you. It's really exciting to be part of this community. And so, thank you, merci. My grandparents, thank you from Alsace, and let's have a great rest of the day.